Well, I hope everybody enjoyed a short break there. I am now going to introduce our next speaker to the stage. We have got Susan Pearce, who is the secretary in the New South Wales Health Ministry. And Mrs. Pearce will be talking today about the priorities for women's health in New South Wales. So I will welcome Mrs. Pearce to the stage.
Thank you. Thanks, Georgie. Hi, everyone. I think I'll sit down because it feels a bit weird standing up.
Can we also just do a reminder to people on live stream?
Oh, it's great to be here. Can I start by acknowledging the traditional owners of the land on which we meet today, and for people online across the state where we're meeting, and pay my respects to elders past, present, and particularly anybody who's here with us today. I've got some slides which we'll go through. I guess the first thing I wanted to say to you is that this is my first day as the Secretary for New South Wales Health. So I'm filling in, obviously, for Elizabeth, who was going to be here today, but you've got me instead, so sorry about that. I've had a bit of a whirlwind of the last few weeks as I've gone from being a Deputy Secretary at New South Wales Health to the Secretary, and it's not something that I ever planned for, that's for sure. Like a lot of women, I think I've drifted into different jobs over the years, some of it by design, but mostly not. But I was saying earlier, I've had the courage to take on opportunities when they've come my way. I just sort of wasn't expecting this one. What I wanted to, I am a registered nurse. I'm still registered to practice to this day, terrifyingly. I have had my uniform on during the last few months, and it's, something that it's always been very dear to me, which is why I haven't been able to give it up. I thought it was worth mentioning the role of women, before I get into the priorities for New South Wales Health for women. The role of women during this pandemic has been a really interesting thing, and unfortunately I've been directly involved in it myself for 2 years. I was just saying, I had my first 10 days off a couple of weeks ago in 2 years, and we've all been the same. And look, I'm not being martyrish. I think people right across the state have experienced similar issues. But when you look at the people on the screen there, obviously Elizabeth, who's gone off and left me, I'm still horrified about that. But she was there. So Elizabeth was she's a Secretary of Health, but she was also the incident controller. So a lot of people don't realise the way the pandemic structure works. So overall, she was the incident controller. I was the controller for the State Health Emergency Operations Centre. I had the pleasure of the vaccine rollout, hotel quarantine, testing clinics, saliva testing. Every time there was a transmission event in a hotel, it was like we were going to have a nervous breakdown, with one case, and then all of a sudden we had thousands of cases a day, and communicating that to people has been really challenging. Kerry, obviously, as you know, the face of New South Wales Health with respect to this pandemic, and Kerry and I have worked together very closely for a long time, and even more closely during this period. And then a couple of the other faces there, Dr. Teresa Anderson, who's the Chief Executive of Sydney Local Health District. Teresa and her team in that district have done the most amazing job during this entire pandemic. Special health accommodation, all run by Sydney Local Health District. Hotel quarantine, Sydney Local Health District. Our first mass vac centre at Sydney Olympic Park, Sydney Local Health District. So, her role in this pandemic, whilst hasn't been necessarily as visible or as public as Kerry's and or mine, certainly has been there every step of the way. And Jo Edwards, she is now the Secretariat Controller, thanks to my departure from that role. So this is the knock-on effect. But Jo, things that we've done over this 2 years have been really genuinely extraordinary, and never in my life have I been through anything like it, personally or professionally, as has been the case for many. When I decided that we needed a mass vac centre, it was actually Jo Edwards that found that location at Sydney Olympic Park on realestate.com.au at about 9:30 one night. And she's like, look what I found, and it's for lease. And so off they went and found it, and we leased that building. Then, of course, I thought, no, let's have a stadium now. So then we were on the hunt for a stadium, and we found that as well. And they're like, okay, I'm sick of you. Like, I don't want any more of your ideas. But, you know, I'm deeply committed to the health system. That's why I'm in this job. And I would like to say I'm the 5th female Secretary of New South Wales Health in a row. So when you look at we've got and Elizabeth created this, and now I know why, since she's about to have her photo added to it. When you look at the photos of the secretaries or Directors General of New South Wales Health, they were all men up until Robin Cruck, and then, as I said, I'm the 5th in a row, 5th female, so all men, and now so far all women. I would say, of course, that we are very well supported by our male colleagues. I shouldn't leave them out because they've been extraordinary as well. But I think in terms of the leadership team who've been at the forefront of this, certainly the women have played their role. So I'll stop there. I can tell you a lot more about that, but I'll leave that for my book, and I'll make sure I'm long gone. So I have to be put into the witness protection program. So if we could go to the next slide. Look, you know, women's health in New South Wales, from our perspective, is a really big deal and a big issue for us, and as it should be. You know, from a nursing perspective, obviously being one myself, and I probably should stop referring to myself as a nurse, but I don't think I ever will. You know, 92% of the nursing and midwifery workforce are women. It's a very, very female-dominated, those professions, but the representation in senior leadership roles are probably the reverse of that in some quarters, which has always been very interesting. One of Elizabeth's key priorities was future health, and future health, as it said there, and I'm not going to read all of this out to you, and in the interest of time, I'm sure you'll be pleased with that, but we do need a sustainable health system across New South Wales that delivers outcomes that matter most to our patients and the community. It's personalised, it invests in wellness and is digitally enabled. I've just put out a new secretary message, and one of the comments that I made in that was that we do need to be future looking in health, but we have to be respectful of the lessons that we've learnt over our long and very proud history. So we're working, and one of my key priorities has been for many years, when I was a Chief Nursing Midwifery Officer for the state some years ago, I made a film called Small Acts of Kindness. If you Google it, I'm sure you can still find it there somewhere. It's a very proud endeavour that I took on, and it really speaks to what we're all here for, and I still think that film has stood the test of time all these years. So involving people in their own care is a really key priority for me, and certainly with respect to our women that we look after. The first 2,000 days framework, again, New South Wales Health very strongly involved in this, and I know now on a whole of government level it has taken on a broader range of things, and I think that's really important too, because health cannot do this alone. But the first 2,000 days of a child's life, from conception to age 5, and what happens from that point, have been found to be so significantly, it's critical. And we all know that, and the importance that women play in the emotional health of their children. I should have said at the start, I have 2 myself plus my husband who is like a child, and you know, somehow despite all of that I've managed to maintain these tough jobs and be a wife and a mother, and I think that all women here you know, understand the struggle that presents to each and every one of us. When you're running late, you're never in the right place at the right time, etc, etc. So you know, those are 2 very significant and key priorities. If we could go to the next slide, please. We've updated our women's health framework, so for the better health and wellbeing of all women and girls in New South Wales across all life stages, and that implementing that framework is obviously a key priority for us, for holistic, accessible, value-driven services to improve the health and wellbeing and outcomes of women and girls in New South Wales. So there are a lot of overarching principles and goals and strategies that framework takes into account. And the important thing for us whenever we're doing things like this is that all of our local health districts and pillar agencies are committed and involved in that work. We'll go to the next one. There it is. Thank you. You can see there, I won't read all of those out to you, but it is about the strategic directions for how we deliver our services and foster environments to help women and girls in New South Wales. It has been developed in consultation with women and girls, which I think, again, is really important. Back to that, I think long gone are the days where the health system decided what people needed without asking people what they needed, and it's very pleasing. And of course, it goes without saying, and I was really interested to hear from the Glen for Women, just as I came in here, about the role that those services provide. Mental health and violence against women, sexual harassment and abuse were the dominant health and wellbeing priorities identified for women and girls in New South Wales in this work. I think that as we reflect on the work that's happening and what you're hearing today, how we overcome those issues, I think, going forward is a job for many of us, and we know that it's going to take a lot longer than it should. And Elizabeth and I were at the UN Women event on Friday, and I don't know if any of you were there, but it was a fascinating day. And that question that was posed about when will she be right, if any of you were there, and if you weren't, I'd encourage you to have a look at it. It was absolutely fascinating in terms of that work. Again, the priorities in action, we've got 20 women's health centres across New South Wales. There's been significant funding attached through grants, etc. And funding will also be provided to the Peabody Women's Health New South Wales. In addition, the government has committed $42 million over 4 years to improve the affordability and access to IVF services across New South Wales, and providing a rebate of out-of-pocket expenses related to pre-IVF fertility testing and so on. And I suppose what I'm describing here, albeit at a very high level and however briefly, is that there is a broad range of activities across the New South Wales health system for women, as there should be. We've also been involved in establishing the first statewide fertility preservation service for cancer patients at the Royal Hospital for Women in partnership with the university. Going forward as well, eating disorder services, again, not necessarily gender specific there, but it is something that affects a lot of women and girls. The Mums and Kids Matter program for mothers and with mental health issues, again, another key piece of work for the health system. And there's one last one there. And what might be nice is, I'm happy to take, if that's allowed, Georgie, any questions that anybody might have. I do find in these types of forums that I don't particularly like sitting here just reading off slides to you. I always prefer something a little more interactive, and nobody ever asks me a question when I say that. So if someone doesn't ask, I'm going to pick somebody. But you can see there that looking forward, there are a range of programs of work underway, and as I said at the start, from my perspective as a woman who has worked whilst in a very female-dominated industry in health for a large part of my career, I've also observed the challenges that being a woman in a senior leadership role, an executive role, experiences. The mansplaining, and in my case often the doctor-splaining that goes on, is always quite fascinating to me. I did ask one colleague once if I was speaking in foreign language, because I'd actually just said that before they repeated what I'd just said. Probably some of my irreverence is going to have to be contained now that I've found myself in this role. But there are issues for us going forward in terms of not just the sorts of programs that we run for women, which are very important for our health system, but how we help other women become leaders and be forthright in their views is something that I think is incumbent upon all of us. Because of the role, as I've said, that we played in the pandemic. If you just take that as one example, and it's a massive example in all of our lives, the fact that the people who led the way through that, and I'm not being self-serving when I say this, are women, has been a really exceptional tough but exceptional thing to be involved in, and finally we're able to say that we're quite proud of what we did. We were too scared to say that for probably the first 23 months of the last 2 years, but it has been an exceptional journey for all of us, and we have every right to be proud of that, and women should stop being afraid to say that they're proud and that they've done a good job. We've done a good job. Thank you.
Thank you so much, Susan. And yes, absolutely, you have done an incredible job. The females at the helm of New South Wales have really helped. So thank you. And I'm so sorry it's been that long for you to have 10 days off.
Yeah.
It's been a rough...
It hasn't been great.
No, I know. I also just want to acknowledge anyone who's watching along to the live stream. I know sometimes when you're at home on a computer you might feel like you're not included, but we know you're there. Hello, thank you for joining us. Now it is my pleasure to introduce the second panel event for today. So Susan, I'm going to... You can exit stage left if you would like, but thank you for coming.
Thank you very much.